Hello there. I'm Mr. Balfour. I'm 74 years old and struggling daily to manage my diabetes, high blood pressure, and glaucoma. It's very difficult for me to remember to take all my medications, and I have a lot of trouble keeping track of my insulin levels. I know I should be more careful in monitoring my different chronic illnesses, but to tell you the truth, I just plain forget sometimes. My pills look the same and I have trouble seeing the lines on the insulin syringe, so I'm never really sure if my insulin levels are correct. To make matters worse, I sometimes forget if or when I last took my medicines. I'm trying, I really am, but it's just hard to remember all these things as I get old. My house is always messy and I don't have the energy or the strength to keep up with all the housework and chores that pile up over the weeks. It's hard for me to prepare meals for myself and even harder to find a way to get to the market. If I buy food, I often forget it's there and it goes bad. So, here recently, I've been eating very little and don't have much of an appetite. I'm lonely all the time. Since my wife died, it's hard for me to get out of the house. So, I've lost track of a lot of my friends. I don't want to be a bother to friends needing to give me a ride to this place or that. So I often pass up on Domino's night or lunch on Sunday. I'm embarrassed by the condition of my house and the amount of clutter. So I've stopped inviting people over. I don't have many visitors or any family close by and feel very lonely most days. I wish I could go for a walk around the neighborhood or down to the beach or even to a park if there was one nearby. But there is so much traffic and the drivers never slow down. I hear about people getting hit all the time. It's just not safe. A friend of mine got robbed and beat up. Not me. Not me. I just stay close to my house. My daughters visit as often as they can, but given their busy lives and obligations back home in Canada, I only really see them once or twice a year. They worry about me a lot and would prefer that I lived in a private nursing home. But I don't want to leave my own home. My home has all the memories of my young married days with my wife. Our children grew up in this house and my own blood, sweat and tears are nailed and screwed into every plank in this house. I don't want to lose it. I don't want to lose my freedom and independence and don't want to let my physical problems get in the way of me living a very long life. I wish there was some way I could stay at home and get some help with house chores and monitoring my health and ailments. I wish something made it easier for me to get out of the house and see my friends. I just don't really know what's out there, what options I have to turn to, and I feel trapped and cut off from the rest of the world. I still have quite a few good years left in me and feel like I should be out there living it and doing something with myself.
Mr. Balfour is a typical example of an older person in the Caribbean who lives at home or who wishes to remain at home as he or she ages. Some Caribbean elders have caregivers, some do not. Even if an older adult has a caregiver, he or she may not receive all the services needed for optimal health. Caregivers are often burdened with juggling their own family responsibilities such as spouses, children, jobs, or school while still trying to meet the needs of their aging parents. Older people, as they move along the wellness-illness continuum, range from being relatively able to provide self-care to relying almost completely on another person to meet their needs. Regardless of where they are located on the continuum, they want to live a life as full and rewarding as possible. However, because of lack of sufficient medical systems, inadequately organized and coordinated community-based supportive health and social services, and the deficiency of adequate financial resources, older persons often find themselves isolated from friends and family, depressed and in poor health. These challenges of aging are well known globally and regionally. Between 2002 and 2009, the World Health Organization, the Pan American Health Organization, and other regional bodies produced key policy documents on aging, chronic non-communicable diseases, and primary health care. These policy reports and care models have helped to reshape the thinking, goals, and action steps for improving care of older persons in the Caribbean. These reports call for revised systems of care, establish targets and guidelines for improving the quality of life of the elderly, and recognize the necessity of a multi-sector approach to holistic care. These policy papers advocate for age-appropriate health promotion and disease prevention, recognize the value of community-based services and a safe and accessible society, and support the contributions of multiple stakeholders to achieve desired outcomes. Despite the unified call for change, a comprehensive plan for information technology linking multiple sectors had not surfaced until the drafting of Pillars for Care of Older Persons in the Caribbean, a comprehensive community-based framework. Pillars is an administrative and functional framework composed of 4 interrelated pillars: primary care with care management, integrated services coordination, population-based health promotion and disease prevention, and planning and accountability. The 4 interrelated pillars or components are linked and made functional through informational technology that facilitates the implementation of a coordinated, multi-sector system of community-based comprehensive care for older persons. Each pillar frames a menu of potential programs and services to address various types of need of older persons as they vacillate back and forth along the wellness-illness continuum. This framework is grounded in scientific evidence and theory drawn internationally and shaped by regional studies, context, and culture. The evidence supporting each pillar separately and 2 to 3 of the pillars together is well tested. However, little evidence exists to substantiate the impact of all 4 pillars operating in concert with each other. The addition of the pillar on planning and accountability is the least mentioned in the literature as a component of the other 3, but remains, we believe, as an essential dominion of data-driven decision-making, planning, and policy-making. We know the number of persons in the Caribbean over 65 years of age is steadily increasing. It is predicted that by the year 2030, 25% of the region's population will comprise of adults over 65 years old. With this demographic shift, there is the increasing need to strengthen healthcare in the Caribbean to adequately address the health needs associated with an aging population. Implementation of systems of elder care based on the Pillars framework is hypothesized to allow older people to remain active and engaged in their community for extended years of healthy and active aging. Let's now flash forward to check on Mr. Balfour after his country has adopted and installed a version of the Pillars framework. He has been provided with various services and programs to address his needs in his community.
Hi again. So glad you chaps stopped back to check on me. Yeah man, since my country adopted pillars for the care of older persons in the Caribbean, my life and health have seen a substantial change for the better. For one thing, I have a primary care provider who is a nurse practitioner who I see regularly at the polyclinic. The van service picks me up for my appointments and brings me back home. So I have no excuse for not going in for my checkups and when I feel sick. I can have my prescriptions delivered to my home instead of having to go to the pharmacy. Life is better. I am also visited regularly by a very nice visiting public health nurse, Nurse Rhonda, who helps to manage my care. She oversees all of my health care needs. She also manages other services provided in my community, which makes living at home so much easier and allows me to be more active in the community. Nurse Rhonda makes sure I'm correctly taking and checking my insulin dosage. I don't like to admit it, but it's so hard for me to see that I'm doing it right, and the nurses are so helpful. My primary care provider and my visiting nurse are barely more than a phone call or visit away. I often get phone calls and messages from them reminding me to do things or checking in to see how I'm feeling that day. One day I forgotten to take my medicine and didn't feel too good. I called Nurse Rhonda and she sent someone over to my house right away to figure out why I wasn't feeling well. She helped me to get better. It makes me smile to know someone is checking in on me. In fact, I have been feeling so much better that I've gotten back in touch with my old friends and am now a regular at the bingo night at the local community center. I enjoy being around my friends again and don't feel quite as lonely anymore. I like to go for walks and sometimes I even go by myself. I walk down to the beach to watch the beach scenes and listen to the waves. Yeah man, since the city built a walking path and put up signs to make the cars slow down, it feels so much safer. The social worker with the Pillars program got me involved with a local adult center at a nearby church where there are a lot of older persons who get together and go to things like cricket matches, Bible study, picnics, and we even go fishing sometimes. I like meeting with other people who share hobbies and enjoy the domino tournaments they plan every year. We even got to a Friday night fish fry. That was okay. Yeah, man. Okay. Oh, I forgot to tell you. I saw my old buddy, Mr. Reed, the other day. He's now living in an assisted living facility. He still has some freedom, and in fact, it seems his confusion and forgetfulness are not quite as bad as they were before he moved into the place. Anyway, I also ran into Miss Finley, my friend who had a bad leg and lived in an old house near to the seaside. She has really benefited from the transportation services in her community, and her diabetes caused her to lose that leg. But with the transportation services provided by the church volunteers, she's now able to get out and move around easier than ever before. In fact, she just was telling me how she has moved into affordable housing that has ramps for her wheelchair and everything. She's also receiving daily hot lunches through the Meals on Wheels program in her neighborhood. It seems she's a lot happier now that she has a way of getting out and about in the community. My whole outlook on this time has changed, and I must say, I like it. Yeah, man, I really do. And I know there are going to be more and more challenges as my body and my mind age. However, I cannot imagine being happier or feeling as good as I do now without the many different programs and services Pillars has made available to me.